So now we're going to transition to our first topic for today, and I'll invite our first panel up to the stage, which is on living with an MPN. So in this session, which will include this panel, but also polling questions and our audience discussion, we're going to be exploring the symptoms and health effects of living with an MPN and how those symptoms and health effects burden the daily life of patients. We want to know those things that most have an impact on the patient's life. We want to know how those different impacts actually then result in impacts on activities in the patient and their family's life. Things that might be important to the patient that they are no longer able to do or do as fully because of their MPN. We want to know also how these symptoms and health effects and other impacts vary. We want to know if they change from day to day, week to week, month to month, or also over the course of their disease over the years. And finally, we also want to know what worries patients and caregivers with an MPN. And so we'll explore that as well. But to get us started on this topic, we have a great panel for you today. We have David, Vivian, Bridget, Vicky, Ruth, and Morgan who are going to be sharing their experiences. And David, you can start us off and take it away.
Good morning. My name is Dave Kapelnick. I'm a 54-year-old marketing and technology business executive living near Denver, Colorado. Most of my life I suffered with migraine auras. It's a major visual disturbance without headache, but the frequency started increasing several years ago. I also had been feeling generally bad over this time, and I attributed it to aging and stress. But in the last year, I lost significant weight and developed daily visual disturbances that led me to see my general practitioner for a physical exam. The exam revealed many out-of-range values in both the CBC and blood chemistry, including high hematocrit and platelet counts. Following some diagnostic imaging and then more blood and bone marrow testing through my hematologist, I was diagnosed with JAK2 positive polycythemia vera in June of this year. I started treatment with frequent phlebotomies and hydroxyurea within weeks. The diagnosis for me was actually welcome, as it explained the pernicious symptoms that I had been experiencing for some time. Without being able to pinpoint the onset, over the last several years I had been struggling with declining physical and mental health. I was very easily fatigued and unable to maintain significant exercise. More recently, I would develop mild chest pains, dizziness, and breathlessness following even mild exertions such as mowing the lawn. I had trouble sleeping as I would overheat and sweat during the night. The neurological impacts for me were even more difficult. I had short-term memory lapses and difficulty maintaining concentration. I frequently lost my train of thought. I felt very dull and depressed mentally. My visual disturbances had always created anxiety for me, as they would occur during important business meetings and presentations, and even sometimes while driving. I always tried to work through the usual 30 minutes duration to avoid looking weak in the workplace. With an increase in frequency, though, these episodes had a major impact on my quality of life. I had tried before to treat migraines, or the migraines with aura, without any success. I was convinced there was nothing that could be done to eliminate their occurrence. As a business leader, my success relies on a sharp and engaged mind. My mental and physical challenges contributed to having an unsuccessful experience in my last role, which I left last summer. Since then, I struggled to gain focus and energy towards a new professional role, as the symptom burden has eroded my confidence that I could regain the trajectory that I was on. I never imagined that I would be away from work for a full year. Finally, after losing 30 pounds in about 9 months, I started on the diagnostic path in the spring. In early June, just following my diagnosis, I felt really terrible. My wife was out of town and called my hematologist to express her concerns about my condition. I quickly had my first phlebotomy and then a second 3 weeks later. I also started on 500 milligrams of hydroxyurea and since then have increased the dose to 1,000 milligrams daily. My treatments have been reducing my blood counts, and I'm still in the process of fine-tuning and developing my equilibrium with the medication. Since the beginning of treatment, I have felt a great reduction in the most significant symptoms. I experience much less visual disturbances, which is a tremendous improvement to my quality of life. I still have limited capacity for exertion, though, as I become dizzy and winded easily, but I do feel my mental clarity is improving. That's really important. I'm seeing my hematologist monthly to establish the optimal long-term treatment, and also I've been consulting with a cardiologist and a neurologist just to ensure that there was no significant damage done. I have good days and bad days, often thinking that I know what my blood cell counts are just by the way I feel. I worry about a possible heart attack or stroke, and that's always in the back of my mind. I've had good health insurance on COBRA, so I have not had any major financial disaster personally. But my COBRA will be expiring at the end of the year, so my wife and I are concerned about the next step and whether the Affordable Care Act will be around, et cetera, to provide us with an option if I'm not employed at the time. I have not considered unemployment or disability claims. I'm still left with a lot of unease about my career. How do I restart my career? With more than a year away from work, do I face an uphill battle to regain my position? Can I keep my diagnosis from potential employers to avoid discrimination? Will symptoms continue or return, or will I develop some side effects to my medication? Is there any damage done to my heart, brain, or other organs? I have great confidence that with my treatment, I can avoid mortality from my MPN. But given the significance of my pre-diagnosis symptoms, I'm less certain that I will get back to what I considered normal. From my experience with polycythemia vera thus far, I found that everybody experiences the disease differently. Blood count impacts seem to vary widely, as do the symptoms. The specific impacts and direction of polycythemia vera are undoubtedly unique to each individual. I am learning as much as I can about the disease so I can get back to living my life the way I did in the past. Thank you.
Good morning. My name is Vivian, and I was diagnosed with polycythemia 19 years ago at the age of 56 after a hysterectomy that was recommended due to heavy bleeding. Post-surgery, my CBC indicated elevated hemoglobin levels. Bleeding has been a persistent problem with my PV and may have been an early indicator prior to diagnosis. From diagnosis until 2009, I took a baby aspirin and needed phlebotomies every 4 to 6 weeks to manage my disease. During that time, my spleen became grossly enlarged and uncomfortable. As time went on, I had difficulty with shortness of breath, altitude, and endurance. My blood counts were very high. Then I switched to hydroxyurea for 6 years with phlebotomies. I had some relief from the symptoms noted before, but as time went on, I started to bleed in unpredictable ways that really affected my quality of life. I bled into my knees 3 times, which physicians found difficult to believe was related to my condition. Another physician informed me that I had the worst blood work that he had ever seen. All my counts climbed to levels which caused my physician to determine that I must change medication. For the last 4 years, I have been taking Jakafi. My counts have come down slowly, and as you see me today, my counts are almost all in the normal range. However, even with medication, my spleen is large but does not cause me discomfort. And in the last year, I have reduced the frequency of phlebotomies to every 8 to 10 weeks. I am now mostly retired, only working in sales from time to time. I am grateful for the good relationship I have with my local doctor who understands my concerns. I need to be careful about overexertion, and the heat this summer has made me very uncomfortable. I can't run or play tennis as endurance has become a problem. Phlebotomies caused me to lose a couple of days as my fatigue level is elevated. Fortunately, I only need one every 2 to 3 months. I find that when my counts edge up, my ability to concentrate goes down. I also have pain in my hands and feet, as well as a feeling that I have a helmet on my head which squeezes. I have attacks of severe diarrhea on an occasional basis. Those would be my worst days. These attacks cannot be predicted and occur when my counts are elevated. I also fear the pain associated with surgeries that have been required for skin cancer. I have had over 40 skin cancers. My first skin procedure was in 2016, a year after I started Jakafi, and it has been suggested that the medicine was a contributing factor. Some of the lesions have been frozen off, but many are basal and squamous cell cancers, which require Mohs surgery, which is a special kind of skin surgery that takes off layers of skin. I face days or weeks of healing and discomfort each time I recover from this surgery. My doctor and I have discussed the trade-off of having to endure the skin cancer treatments in exchange for the knowledge that my blood counts are in check. At this point, I have decided to continue with the Jakafi. My doctor has worked with me to ensure that I can travel with my husband from time to time without issue. I am actively involved in Silver Sneakers, a strengthening program for seniors. And on my best day, I wake up with minimal pain, a clear head, and energy. I can garden, walk, and play with my grandchildren. PV is a very individual disease. Nevertheless, I'm still concerned about the future, what the future may hold for me as my disease changes from year to year. The cost of my medication causes me great worry. If I were to lose my coverage for treatment, I wouldn't be able to afford to make up the difference. I face substantial copays and the donut hole, and worry that I will not be able to access this life-saving medicine. I also fear that one day my medication will quit working for me, or my bone marrow will stop producing the cells necessary to live, that I will get a more aggressive cancer or an infection that can't be treated, or that I will outlive my money because of huge medical bills. Thank you for coming here today and hearing my story.
My name is Bridget Broden. I'm a 49-year-old assistant vice president working in financial services operations. I'm a Gulf War veteran and served in Operation Desert Storm. I was diagnosed at age 45 in 2015 with essential thrombocythemia due to hyperproliferation of the platelets at the bone marrow level. I have the JAK2 mutation. For about 1 year prior to my diagnosis, I began to experience fatigue. When I say fatigue, I don't mean tired. I mean unable to move. My doctor began checking my blood every 3 to 6 months to see what was going on. My physician would inject vitamin B12 with hopes of giving me energy. It never lasted. As I continue to live with ET, I have experienced a number of symptoms. This includes tingling, throbbing, and numbness in my hands and legs, itching, joint pain, fatigue, problems concentrating. The symptoms used to happen every once in a while, but since March of this year, the issues are occurring daily. On a daily basis, I struggle the most with tingling and numbness and burning sensations. To understand what this feels like, imagine minding your own business and suddenly something is creeping up your arm or your leg. Imagine that feeling when at work or in a meeting or on a date. It's very disconcerting and hard to be out in the world or at work when this is happening. Like I said, it's happening now on a daily basis. I've also had a burning sensation coming down my leg, also happening on a daily basis. I've even tried going to a nerve doctor in hopes that it was some type of nerve problem, when it's simply a symptom of ET. They, of course, found nothing wrong with my nerves. For the problem on focusing, it's as if I have a haze of some sort preventing me from focusing and concentrating, almost like I'm intoxicated. Because of this, it's taking me longer to complete tasks at work, which is difficult as I am a manager and I have which is difficult as I have many responsibilities as a manager. It has been a dream of mine to go back to school to complete my master's degree, but I'm afraid to even start because I would have to drop classes due to my focusing and concentration. Fatigue has affected me so much. I'm unable to get to work early as I'd like because I'm physically unable to get out of bed without a lot of exertion. I don't do anything social anymore. I used to be in the Army and was very physically fit. At this point, though, if I can manage up to 30 minutes at the gym twice per week, that's considered a win for me. But I used to be capable of much more. At the same time, I don't look sick, so people don't understand that you look fine but crazy due to symptoms. I had been feeling like this back in months ago, and I was unable to convey this effectively to the doctors for a long time. It wasn't until I was seen by an MPN specialist that I had this symptom acknowledged. I was always anemic and had been on and off iron pills and even iron transfusions. To describe how I experienced anemic, imagine you wake up and you have legs made out of elastic. You have to peel yourself out of bed because you feel so low. In 2017, I had an iron transfusion, and currently my anemia appears under control. But I don't know what the future holds, given I have ET. I am currently on anagrelide. I'm not sure how effective the platelets are being controlled, as I experienced several clotting episodes. First in 2016, and most recently, March 2019. I work in a secured room because my team handles checks. It's like working in a daycare when everyone is sick and the germs are circulating around. During the first week of March, I'd come home from work thinking I just had a cold from the germs and I thought that I had a cough. I went to my restroom and started spitting up blood clots. I went to the emergency room because they know that I have ET. They did a chest x-ray and CT scan. My platelets were elevated due to a bacterial infection, is what I was told. I still wasn't feeling well, and I scheduled an appointment with my hematologist within the same week as a precaution. There was nothing that they can do for me. I am currently being seen by an MPN specialist who is taking my symptoms seriously, so at least I feel like I have someone who understands the disease. Thank you.
My name is Vicki, and I was diagnosed with essential thrombocythemia almost 8 years ago. My platelet counts remained in the 600s generally, so I was only prescribed low-dose aspirin and watched, first every 3 months, then every 6 months, then told to come back in a year. I have the CALR mutation type 1. I found this diagnosis baffling at first and only found out when meeting with a second hematologist-oncologist to confirm the diagnosis that it was in fact a type of cancer. As there was a great deal of cancer in my family, I was frightened to learn that it was indeed cancer, albeit an indolent type of malignancy. My mother, father, aunt, uncle, 3 cousins, 2 of whom were in their 30s, died of various types of cancer. However, as I had few signs of ET other than high platelet counts and some excess bleeding after back surgery, I managed to keep my diagnosis in the back of my mind most of the time and go on with my life. I basically had no symptoms and took a baby aspirin a day. Over the last 8 years, I've tried to stay on top of research in the field as I'm a medical and biotech journalist. It has seemed to me that basic research and drug development for MPNs are lagging behind that for other blood cancers and lymphomas, and this alarmed me. Ironically, soon after my oncologist said that my condition appeared stable and that I was low risk for transformation to MF or AML, my platelets began falling in the following months and are now in the high 200s. My LDH began rising, and I became anemic. In preparation for a second back surgery last year, after undergoing pre-surgical testing, I learned that I also have MGUS, monoclonal gammopathy of undetermined significance, pre-cancer, a different type of pre-cancer. I underwent a bone marrow biopsy last summer in the office of the lymphoma specialist I saw to discuss the MGUS, and little marrow was obtained, which I later learned was, with my falling platelet counts, a sign that my ET is likely transforming into MF, which frightens me greatly. My oncologist had not wanted to do a bone marrow biopsy at the time, nor does he now, because he says there are no good drugs to treat me now that won't make me sick, and that we're going to watch the counts every 3 months, as well as the MGUS. The plan is to wait till I am symptomatic and then treat. With which drugs, it's not clear. My oncologist has said that hopefully when I need to be treated in a few years, hopefully and not sooner, there will be better drugs available with which to treat me. Currently, I'm experiencing some symptoms, but not the major ones for MF, which I dread. I do tire more easily, I have less stamina and less exercise capacity. I have occasional pain in my left and right sides and some spleen enlargement. I also have some tingling in my limbs occasionally. I try not to focus on these phenomena, and I can count myself fortunate not to have the major sick symptoms yet, and try to stay positive. However, I know what may lie ahead, and it is a poor quality of life, suffering, and a shortened lifespan. In short, the future with MS is very frightening. This awareness can affect my ability to concentrate on work and can make me reticent about participating in some social activities. As orphan diseases, the MPNs have not benefited from sufficient attention and funding. As a patient, I am desperate to see work on new treatments that will arrest the progress of these cancers and give us patients better chances of longer, healthier lives and even cures than we currently have.
Good morning, and thank you for making it possible for us to all be here today. My name is Ruth. I'm a writer and a strategic communications consultant specializing in health, science, and renewable energy. I'm the daughter of an astoundingly strong 86-year-old mother and kindest man in the world father, now deceased, both first-generation Americans of Eastern European immigrants. I'm a proud mother of 2 amazing young men and the wife of an expat Brit, the love of my life and best friend. I'm a lover of music, the arts in all forms, nature, cycling, and breathing. Some days, I still think I have more energy than most 30-something-year-olds. I just celebrated my 62nd birthday. Other times, I'm reminded that I have plenty of days, even months, that I am challenged by seemingly unrelated, but always actually related, symptoms of a very rare condition. I was diagnosed with an MPN 23 years ago, long before they were called MPNs, before significant research, before support groups, and before they were called blood cancer. I was first diagnosed with ET, confirmed with a positive JAK2 mutation. For as long as I remember, I had unexplained, quote, unexplained bone pain, migraine headaches with neurological symptoms, including a probable small TIA from sticky platelets, and irritable bowel syndrome, which mysteriously went away once my blood counts were normalized decades later. For many years, my platelets were close, but never reaching the 1 million mark that would turn me from aspirin to a more aggressive treatment. When 10 years ago I was hospitalized for abdominal clots, an occluded portal vein and now hypertensive portal system, I began the traditional low-dose hydroxyurea, an anticoagulant warfarin. When 5 years ago routine blood work showed my platelets were down and my red cells were up, I was diagnosed with PV, sent for what I called the dreaded bloodletting, as I have veins so tiny that the large catheter inserted into my arm for phlebotomy was a painful challenge for even the most skillful and wonderful oncology nurses. Phlebotomies were curtailed as we found a higher dose of hydroxyurea kept both my platelets and red cells in check. Last year, I had early colon cancer, a bit ironic since I've eaten a healthy, largely fresh food diet for decades, long before it was a trend. They removed 10 inches of my colon and 17 lymph nodes. We were elated when we got the results showing no remaining signs of cancer. I went home and 24 hours later had a major GI hemorrhage, followed by several days in the ICU and several months of severe anemia and healing. What I knew became painfully true. I'm at risk for both clotting and bleeding, a difficult balance to maintain. I searched out a New York City-based MPN specialist and decided to be more proactive with my treatment of PV. The first step, the first repeat bone marrow biopsy in 23 years. As a result, just 3 months ago, I was diagnosed with myelofibrosis stage 2, luckily with no other mutations identified. So I've experienced the challenges of ET, PV, and now MF. In my hockey-loving family, that's my first hat trick. I live my life joyfully, gratefully, and with an often invisible condition, aware of increasing symptoms that affect my daily life, and aware that I'm in transition and have no idea what the future will bring in 8 months or 8 years. Walking through the airport yesterday, I was limping from a significant hip pain. When I bruise, it often takes months to heal. From a sprained ankle that showed bone marrow edema and wouldn't heal for nearly a year, to this bruised hip from a fall last December, months of physical therapy and persistent inflammation and pain have kept me from the walkable downtown lifestyle I thrive on and the fitness and stress reduction I count on for as many as 6 months at a time. Until last year, many of my closest family and friends had no idea I had a major health issue at all, let alone a chronic blood cancer. I do a great job of pushing through it outwardly. I never share what's behind these eyelids when they close, how sleepless my nights are. Yes, that has to do with the ever-persistent night sweats related to MPNs, and some bone somewhere is always painful. But mostly, it's because of the constant voice in my head that wonders how long before I experience symptoms that aren't so hidden. How long before I'm severely anemic? How long before my spleen is affected? If I would consider a transplant? What if I can't work? What if I can't dance at my son's wedding next year? What if I can't play with my grandchildren yet to be conceived? And is it 8 months or 8 years? Thank you.
Hello, my name is Morgan, and I'm 52 years old. I'm married, and I'm the mother of 3 children. I live in the Chicago, Illinois area. I work full-time as a project manager for an international meeting and event company. I was diagnosed 9 months ago at age 51 with primary myelofibrosis. I'd gone for a yearly physical, and my blood counts were off the charts. My doctor was concerned and repeated the blood work and came back with the same results. After referral to a hematologist-oncologist, further blood testing, and a bone marrow biopsy, it was confirmed: primary myelofibrosis. I, of course, Googled this cancer that I had never heard of. The information online was daunting, scarily so. I allowed myself that one pity day and have ever since tried to educate myself as much as possible and to seek the best treatment to prolong my life. I do not want to be a statistic. Since diagnosis, my symptoms have unfortunately worsened. I have experienced spleen issues and thrombosis. My most recent TIA, or mini stroke, occurred just a few weeks ago as I was preparing to participate in this meeting. After my doctor cleared me to fly, I felt I had to be here to share my story and to help show the importance of finding a cure. I see an MPN specialist at the Mayo Clinic in Rochester every 12 weeks, and I go for blood work at Northwestern Memorial Hospital in Chicago near my home every week. I have a phlebotomy whenever my hematocrit level is over 42, which is about 3 out of 4 weeks. My quality of life has changed due to extreme fatigue and bone pain. I'm not nearly as active as I was. The symptoms I most deal with daily are nausea, extreme fatigue, bone pain, temperature sensitivity, enlarged spleen, tingling of hands and feet, and headaches. I'm currently on hydroxyia and aspirin daily, although my symptoms continue to worsen. As I already mentioned, I've already experienced a TIA due to the myelofibrosis. The fatigue, bone pain, and occasional nausea from the hydria have a great impact on my daily life. Every morning when I wake up, I hope it's going to be a great day. But it's extremely frustrating to have no control over your physical state. I always do try to have a positive outlook and put on a smile, though. Having an MPN affects every area of your life and those close to you. People don't know how to react to you having a cancer that is chronic and that can't be seen. Because the symptoms can't be seen, you often encounter ignorance and find yourself having to explain what it is you have exactly. For example, after I was diagnosed, a now former boss asked me, did I really have to go to the doctor as often as I was going? It's just a blood thing. And why are these symptoms even real? A friend, after hearing, said to me, well, at least you don't have the bad kind of cancer. My life has drastically changed over the past 9 months. I was that positive and friendly person who is very active. I volunteered, I went to everything, and missed nothing. I was always very busy. I used to walk 2 to 3 miles in my lunch hour. Now I take a short nap to make it through the day. I'm no longer active in professional organizations, and I no longer sleep through the night due to extreme night sweats. The effect on my children is huge. My counts and symptoms have changed over this year. My symptoms have worsened as the year has gone on. If I'm tired or stressed, they worsen even more. Simple things like washing dishes or filling a cooler with ice are now near impossible due to my sensitivity to temperature. The itching after a shower is unreal. On my worst days, I want to cry from the pain and frustration. This is so unlike other cancers, where you have a course of treatment with an end in sight, a tumor to eradicate, something to work towards with a clear goal. With myelofibrosis, it's constant, which adds to your daily frustration. I do have some good days where the pain is minimal, and I can just be me without thinking about living with a blood cancer. Living as a person with an MPN means worrying about other health conditions developing and then being unable to possibly have a stem cell transplant in the future. This is very real and always in the back of your mind. I'm very worried about having another TIA or stroke. To quote my neurologist, it's not if, but when. I know this meeting isn't about reimbursement issues, but even with insurance coverage, I have racked up almost $20,000 out of pocket due to treatments, testing, and doctor appointments since December 2018. I've used up almost all my vacation time from work for appointments. A positive that has come out of all of this, though, is meeting the wonderful nurses, doctors, and others who work tirelessly to treat and help those of us with this. I am so very fortunate that I have an incredibly supportive network of my husband, children, relatives, and friends. Without them, this would be unbearable. Thank you.
It's incredibly brave to share your stories here at the beginning of today. So please join me in a round of applause for our full panel. Thank you very much. And you can, thank you. So now we're going to transition into a set of polling questions on this topic of living with an MPN. So please pull out your phones or other devices that you're using to answer the polling questions. And we'll go ahead and get started with those. There we go. Okay. So we have a few polling questions here to get a sense of the different experiences we have in the room. help inform our discussion that will immediately follow. So our first question on the topic of living with an MPN is to please select the 3 symptoms that impact your daily life the most. And here, pick the top 3, so you're limited to 3 selections. Your options are A, fatigue, B, bone pain, C, pruritus or itching, D, tingling, numbing, or burning in your hands, feet, or limbs, E, vision problems or other visual disturbances, F, night sweats or insomnia, G, abdominal discomfort, including things like enlarged spleen, early satiety, and GI problems, H, problems with sexual relations, feeling sad or depression, I, if you do not have any symptoms, or J, if you have other symptoms that impact your daily life the most that are not listed on this slide. So again, please select the 3 symptoms that impact your daily life the most. I told you this would get a little bit harder than the first set. And as you're answering these, be thinking about why it is you're making these selections, because as we come to the audience discussion, that's exactly what we're going to want to hear from each and all of you. All right, so while final responses are trickling in, it looks like of the symptoms listed, fatigue is the one that most impacts your daily life the most. I should note the percentages here are percentages of responses. Total responses, not percentages of individuals. Because you're allowed to select more than one option, there'll be more than one response per person. So the number 1 symptom impacting daily life reported by our audience here in the room and on the webcast is fatigue, standing apart from the range of others. Slightly above some of the others is bone pain. And then there's a fairly close representation across the other symptoms: pruritus, tingling, numbness, and burning, different visual issues, different sleep-related disturbances, abdominal discomfort, and also problems with sexual relations or feeling sad or depressed. It seems that there may be one or a few people represented that don't have any symptoms, and also a few people that have said that there's some other symptom that impacts their daily life the most. And if that's one of you, we definitely want to hear about that during the audience discussion. Make sure we're not missing out on something that's important since you've selected as one of your top 3 most burdensome symptoms. If we go to our next question. So this question is, have you had to reduce, stop work, or retire early due to your MPN? And so the options are A, yes, you have stopped working altogether because of your MPN. B, yes, you have cut back to part-time because of your MPN. C, yes, you have retired early because of your MPN. D, you are on a temporary work leave or absence because of your MPN. No, you retired as scheduled, not because of your MPN. F, no, you continue working at the same pace, even in light of your MPN. Or G, you weren't working prior to having your MPN. So please select the one that best represents whether you've had to reduce, stop work, or retire early due to your MPN. Okay. Looks like final results are, responses are trickling in. It looks like a little under a third of you are still working at the same pace in light of your MPN. think we heard a little bit about what that looks like from our panel, but certainly want to hear more. I know even though you may be working at the same pace, it may be difficult. And so we want to explore that in our audience discussion. About a fifth of you have stopped working altogether. That's quite a significant proportion to have had to stop working altogether, combined then with about another fifth of you that have had to cut back to part-time or retire early. So we want to hear about what about your MPN caused you to reduce it or stop working, and just a little bit about your decision-making related to that. And then there were quite a few people that have retired but as scheduled or that weren't working prior to their diagnosis. And nobody is on temporary work leave of absence. Go to our next question. So this question is the biggest struggle that you face that is attributable to your MPN, and your options are anemia, transfusion dependence, spleen size, recurring bleeding and clotting, including thrombotic events, skin lesions, the severe symptom burden, you do not face any physical struggles, or some other physical struggle that is the biggest physical struggle that you face that's attributable to your MPN. So luckily I have the key, so I'll be able to tell you what some of those smaller slices are. Okay. Okay, so anything that doesn't have a number, I believe, is 10% or less of the respondents, and you are only given the option to select one, your biggest physical struggle. So clearly, the greatest physical struggle that you face that's attributable to your MPN is the severe symptom burden. 45% of you selected that. About just over 10% of you said that you don't face any physical struggles, and then 10% of you said there's some other physical struggle that wasn't listed that is your greatest physical struggle that's attributable to your MPN. So certainly want to know about what those other things are when we go to the audience discussion. Again, the things that are there that are less than 10% are anemia, transfusion dependence, spleen size, recurring bleeding and clotting, including thrombotic events, and skin lesions. We can go to our final polling question for topic 1. And so in totality, looking at everything, the symptoms, the physical struggles, the other impacts that MPN has had on your life, please rate the overall impact of MPN on your life. Have you had no impact for A, B, mild impact, C, moderate impact, or D, severe impact? Okay, looks like only final responses are trickling in at this point. So it looks like just under half of you have reported that the impact that MPN on your life has been severe. Over a third of you have said that the impact MPN had on your life has been moderate. And then a number of you have said that the impact on your life has been mild. Nobody said that MPN has had no impact on their life. So I think that's pretty profound, and we want to really dissect and understand, when you say that you've had mild or moderate or severe impact, the MPN has had that impact on your life, what that actually looks like. What are the impacts? We used work as one example, but beyond that, we're going to want to know impacts on your social life, your home life, your family life, your hobbies. We've heard some examples of those things from our panel, but we want to know from all of you that are participating what those impacts have looked like, and if there are activities or aspects of your life or quality of life that have been diminished, what those are and what drove that impact. So with that, that leads us into our audience discussion. If we can pull up the discussion questions. So here, we're, again, building on what we've just started covering from our panel and from our polling. What I'm going to ask you to do as we work through these discussion questions is for our patients and our caregivers, if you have something to share, just please raise your hand. When I call on you, someone will bring a microphone to you, and I'll just ask that you state your name and at least state your current MPN form that you have. For those of you that are on the webcast, if you have something to contribute, please email communications@mpnrf.org, and Lindsay will be checking that email box and reading out your responses throughout the course of this discussion. So you have a voice too. So let's start where we started with our polling questions, which was on symptoms. And symptoms came up a number of times. It came up again when we were talking about physical struggles. And you'll recall that that was the largest slice of the pie of having an impact on your daily life. So we know that there's a whole host of symptoms, but perhaps we'll start with your most burdensome symptom, the symptom that you view as having had the greatest impact on your life. We'd like to hear about that symptom and why you would view that symptom as being the one that has the most impact on your life, whether that's because it's impacted you in some particular way or your life. We'd like you to share that with us. So who would like to kick us off sharing their most burdensome symptom experience? Yes. Just hold on for 1 second for the mic.
I'm sorry? Oh, my name is Jerry Thomas.
Jerry.
We currently reside in Texas. Oh, and I have MF. It progressed from PV to MF about in 2017. And we had to leave our home in Oklahoma, our farm, so that I could be with good doctors because there really weren't hematologists who knew what to do with me. Mm-hmm. And it has disrupted our lives. I was diagnosed in 2009 with PV, and then it migrated, as I said, into myelofibrosis. So it has greatly affected the way we live. I make frequent trips to my doctors at MD Anderson, and I've been in the emergency room in the middle of the night 4 times. It's changed my life greatly, and my husband's. Thank you.
Yeah, so Jerry, I have a follow-up question for you. So you talked about a little bit about the impact of needing to be near care.
Yes.
And that's had an impact. You also mentioned that you had to go to the emergency room a number of times. Can you tell us about why you needed to go to the emergency room? What was the...
I have had blood clots in both lungs, DVTs in both legs that made me very ill for quite a while. I think mainly I had infections. I had high fever. One time I was there for 12 days, and then the 3 days and 7 days, and it was just all over the board. But great medical care there, but there's not a lot you can do when you're loaded down with blood clots. Mm-hmm. And it caused infection, high fever, and they wouldn't release me until the fever went away, which I often have fever every day now.
Wow.
So,
And how often do you have a clotting event?
well, I was in Chicago about 2 or 3 months ago and had a clot then in my lung. Didn't know it until I got back to my scheduled meeting with my doctors, and by accident they found it. I had no symptoms. So I have a complication called Leiden factor 5, which causes clotting also. So not only does the thick blood cause it, but I have that.
And you would say overall it's these clots that have of all of your MPN symptoms that have the greatest impact on you?
That and bone pain,
Bone pain.
and daily fever and night sweats.
Yes. The list, the constellation, yes. Thank you very much, Jerry. Very helpful. Other experiences with symptoms, most burdensome symptoms. We have a hand in the back of the room.
My name is Jean. I'm from Pittsburgh, Pennsylvania, and we have wonderful physicians in Pittsburgh. However, I was diagnosed in 2009 with PV, and it was very difficult to find a doctor that understood what I had dealt with for many, many years. Severe headaches, they told me they were migraines, hormonal migraines. I had absolutely terrible joint and bone pain. I had an accident. I was put in physical therapy. My neurologist told me there was nothing wrong with me. They sent me to physical therapy. Physical therapy, my joints would burn and hurt, and no one would believe me. They then put me in thermal pull. I would go to thermal pull, and I would come out, I would just be itching. Everybody told me that it was all in my mind, that I didn't want to go back to work. They also said that I was being hypersensitive, and they sent me to a psychologist. On top of that, I ended up having other issues on top of that with the severe throwing up after being in a thermal pool. And everybody kept blaming it on me being a psychotic situation. I fought for that for approximately 4 years. And that's when I found out that the MPN Research Foundation was there to have a symposium. And that when I got to the symposium, Dr. Mesa had a chart, 24 symptoms of a MPN. I had 19. I came back, and my counts were extremely high. I started seeing pink and purple spots. So I went back to my doctor, and I said to my doctor, "What is this?" He sent me again to an eye doctor. After every other symptom, he sent me to the other specialist. When I went to my eye doctor told me, he says, "You're about ready to rupture a blood vessel in your eye." In front of me, he took and he faxed to my eye doctor, or to my oncologist, that I needed a phlebotomy. Days went by, and finally I said, I have to do something. So I called and I said, I need to come in. At that point, my doctor said, "What do you want your counts to be?" This is what patients deal with. And I'm in a great city with medical professionals that understand a lot of different scenarios, but they don't understand MPNs.
Sure.
I have been in an emergency room, got hit with a bimbo truck. The bimbo truck hit me, and I ended up in the ER. They wanted to give me aspirin. I said, I can't take aspirin. And he said, well, you need to take aspirin, or you need to take ibuprofen. And they wanted to give me other things that I was allergic to. And getting back, probably the only thing that has saved me in the past, I was allergic to all the pain medicines they wanted to give me. I ended up taking 4 Advil 3 times a day. And on top of that, after I had my monthly allotment of Imitrex, I would take Excedrin migraine daily, because I could never get my head off a couch. I laid on an ice bag or a heat bag trying to save myself from all these burning symptoms. So I think, to me, it's been very challenging, the awareness, not with the MPN specialist world, but all the other hematologists and oncologists, because they just don't get it.
Sure. No, that's very helpful. One thing that I do want to understand a little bit more about, and to help me answer one of the questions on here is, so you had this set of 19 of the 24,
Yes.
checking off the checklist that you saw. Were they, were these things that were present daily? Were they all present daily, or were there, a few of them that really were driving, you saying that you were, stuck laying on your couch? What was it that was impacting you the most?
The most was the headaches.
The headaches.
The nonstop migraine headaches, day in and day out, and the pruritus. I literally was tearing my skin off of me. I threw away mattresses because I thought I was allergic to my dog, or when we moved back from Florida, I thought maybe we got bugs in our mattresses, and we ended up tossing those. I thought my dog may have had scabies or something, and I mean, the itching was, and nobody understood it. They wanted to give me antidepressants because they thought I was nervous.
Sure. Thank you very much, Jean.
Thank you.
James, I just have one comment that came in on email from one of the webinar participants. Thank you, Linda. She reported, my most severe symptom is not being able to stand or sit up straight after a few minutes from head pressure and lumbar pressure, as well as vision issues. Currently going to the Cleveland Clinic regularly to determine if this is all my NPN/ET or something in addition.
Wow, thank you. So if I recall, in the polling questions, there were two symptoms that seemed to rise to the top as most, being selected as top three amongst this room, and those were fatigue and bone pain. And I was wondering if anyone has an experience to share, since I know so many of you reported that so highly, of how fatigue or bone pain, either of those two symptoms, has impacted your daily life. Right here, Lindsay.
I'm an ex-marathon runner, but my experience is the same as, sorry. I'm an ex-marathon runner and used to long effort, but my experience is the same as many I've already heard here. And enduring effort, whether it be washing the dishes or walking around for an hour showing tourists around, can wipe you out for the day.
Sure. And just for our transcript, David, can you say your name and your
Sure,
form of MPN?
I'm David Alexander.
And MPN?
Polycythemia vera.
Great, thank you very much. Other experiences? Yes, right here.
Rosemary, 75, newly diagnosed with PV 9 months ago, actually 6 months ago. That's when they found the JAK2 gene. But my symptoms started a year ago. I had headaches. Suddenly I had unexplained bruising all over. Fatigue has been an issue on and off, I'd say, for several years. And it's only been since the PV that I finally figured out that that could be the reason. I have to nap. I can't do as much as I used to do. But I'm still considered, or I still consider myself mild in terms of my symptoms because I don't have as many, and they're not as frequent, and they're not as severe. The greatest is really the fatigue. I go to the gym 5 days a week with an hour of exercise. I have fuzz brain, as I call it, and one can never tell when it's going to hit. I have sleep issues, but it's not because of night sweats, which I do have periodically, but that doesn't bother me. I just get hot, and I tend to have run a low temperature anyway. I remember 98.6. I'm always a couple degrees under. So if I'm sweating, it's not really hot. It means I'm normal. But I have bladder issues, in which case I can wake up at least 7 or 8 times a night, which means I don't get very much sleep. I just got a new Fitbit, in which case I can now track my sleep patterns, and my goal is at least 6 hours, which means I can make it through the day a little bit easier. Mornings I do exercise, or the things that require physical activity. Afternoons are shot. I'm retired. I garden. I work in my house. I have a 1890 Victorian house that always has something that needs to be done. I live alone, so it's me or me. But as I said before, I consider my symptoms. I do have joint pain. This spring, I had a bad case of vertigo, and I don't know whether it was the ear that was diagnosed as my problem or whether it was related to the PV. My platelet count is what has been out of whack also, but I've considered PV, so I don't know whether I'm really an ET or a PV, and it doesn't matter. It's, I have the JAK2 gene.
Right.
I'm being checked by a hematologist every 3 months, but initially my internist ignored my platelet count, which was in the high 600s. And because I was part of a health study in Baltimore, where I live, looking at neighborhood patterns, and I'm the control. But the doctor from the study in October of last year said, "Sweetheart, you better get to the doctor. Your platelet count's out of sight. This is not normal." So I changed doctors and have been slowly kind of working through. I have a good hematologist at Hopkins now, and am very happy with the quality of my care so far.
Sure. So I have a couple of things that I want to ask about. One, you had mentioned the symptom of, I think you called it brain fuzz.
Yes.
Could you give us an example of what that looks like, what you mean by that?
Oh, I have disorientation. I could be, say, driving on the highway, and I lose track of where I'm going because I tend to go into repeated patterns instead of where I really want to be going.
Okay.
I read a lot, especially if I don't have energy. I read because I can't garden because it's too strenuous or it's 90 degrees out, which, I don't do anything in 90-degree weather. It increases the fatigue. I can't work crossword puzzles as well. It takes me three times during the day to kind of get the memory cells working so that I can actually do it. Okay. I just don't function with the kind of acuity that I used to be able to. Okay. And I used to be able to walk 45 minutes to the library and back without any trouble. I can't do that now. I can park halfway, walk there, and take, our free circulator, most of the way home. So I can see my energy levels and acuity slowly declining over time, but I still, I push it. I don't try to accept what's going on. I try to ignore it and simply move on with whatever I need to do.
So it's interesting. So do you find that when your physical fatigue is greater, that happens at the same time that you have
no,
kind of
not
the mental
necessarily.
fatigue?
No,
Not necessarily.
No.
Okay. And then the other thing that you had mentioned was that you have energy to get through what you need to do in the morning, and then in the afternoon you're wiped out. After lunch, it's it. Yeah, and yet you described that as mild. That sounds more significant to me. But if that's kind of the norm, do you have days that are more severe than that? And if so, what does that look like, and how often?
Well, if it was less severe, it means I didn't have to take a nap. So that was like a good day.
Yes.
And I could do everything that I wanted to. I do things quickly, too. So if I pace myself, then I can get through the day a little bit better. It also has to do with my diet. The other thing I think to understand for me, in my case, with PV, is I have a lot of borderline other issues. Like I'm pre-diabetic, pre-cholesterol, pre-high blood pressure, osteopenia. I'm on Synthroid because of the, thyroid metabolism. I have frequent eye infections. So, balancing diet and exercise is the way that I've kept off any kind of insulin. And I've been able to keep my glucose levels down. Yeah. So I'm terribly motivated on that. But now I've got this other issue, so my worry in the future is, especially after listening to the panel, what's ahead of me. And that's part of the reason I came today, to inform myself and to do a lot of praying that my symptoms don't worsen, because I still consider myself mild, because compared to what other people have said they had to deal with. Maybe it's mental attitude, I don't know.
Yeah, no. And you've done more than learn. You've helped inform us.
Well,
with
I can still
sharing,
do the
so.
exercise 5 days a week. 'Cause I can't on the weekends. I take off on weekends. You know,
good to know.
it doesn't fly with me, and I look forward to the weekend because I push myself all week.
Sure. Well, thank you very much.
You're welcome.
I do have another comment. Actually, I've gotten a couple of emails and wanted to share some. This one from Nancy Bartholomew, who has MF, diagnosed in 1981. I suffered from completely disabling fatigue, bone pain, and shortness of breath since 1997. In spite of my disease symptoms, I was once a high-energy road warrior executive. I have been unable to work since 1997, and 2 years ago my husband had to retire to care for me because I am no longer able to take care of myself. Even the smallest tasks of self-care, bathing, washing my hair, making breakfast, are difficult for me. My life was completely changed by my diagnosis. I was 23 when I was diagnosed. I've never been completely healthy in my life. I am now 61 and lived with MF for 38 years. I'm on the cusp of needing a bone marrow transplant, and I live in terror of death every day. Thank you, Nancy.
Yes. Yeah, so one thing that I've been hearing from you as you've been sharing is that it really is a number of symptoms. And so I had been probing you about a top symptom, and it was important for us to know if there, for some of you, if there was really one thing driving the impact. But let's maybe focus on the second question that we have here, which is about really the impact of the condition overall and the impact that that's had on activities that are important to you, whether that's meant that you had to stop doing some activity or even scaling back some type of activity in your life. And I do want to know what is contributing specifically to that limitation, but importantly, we want to know the range of things that are impacted by your MPN. Yes.
Hi, my name is Susan, and I have PV. I think I've had it for quite a few years, but just was recently diagnosed this past summer. One of the biggest things that has changed in my life is I've had to give things up. I no longer can cook because I can't follow directions. My sleep is horrible. It's like my body has forgotten how to sleep. The fatigue is horrible, but I still can't nap. I'll go 48 hours without sleep sometimes, and then I just feel like I'm at death's door. I had to quit cooking because I made so many mistakes in putting meals together. I have visual problems. I really cut down on my driving. I'll walk into a room looking for something, and it can be right in front of me, and I can't see it. It's like a blind spot. I have blind spots. And I used to be very active in crafts and sewing. I can't do any of those things anymore. It's like 1 + 1 doesn't equal 2 to me anymore. Things don't come automatically. And that's, yeah, and I also have thyroid problems, but this has been overwhelming. So I babysit. I can babysit my grandchildren, but then again, I'm afraid of something happening because I'm just not aware of my I'm not sure what it is, but it's just like a brain fog that is with me all the time, and I just feel like I am going backwards instead of getting better. I just feel like I'm getting worse, and that's that's one of my biggest problems, is the concentrating and the sleeping. And
And do you find that it's
Right.
harder to concentrate when you're more fatigued or on those nights that you aren't able to sleep?
most definitely becomes worse. Yes,
Okay.
yes. And then I just give up altogether, and all I can do is watch TV. It's
And
It's real.
how long have you been having this brain fog?
for a couple of years now. For a couple of years now. And I even said to the doctor, it's a shame. People in their 70s may go to the doctor and say, I'm having difficulty remembering things and this and that, and do I have Alzheimer's? But you know what? If you look at somebody's CBC and their count is real high, that's a contributing factor. That can produce fog brain. But no, they'll send them here and send them there. I've been sent to psychiatrists and everything else. But it's a very prevalent problem for myself. I don't know how many other people. But yeah, it's all encompassing.
Absolutely. Thank you, Susan. Other experiences of activities that you're not able to do as fully because of your MPN or MPN symptoms? We had some good, we'll come here and then over. Yes.
Hi, everyone. My name is Sandra Ross, and I currently live in Ashburn, Virginia. I was diagnosed in 2005, and my symptoms were hardly anything. I was never sick a day in my life until I was diagnosed. The doctors all thought I was going through the, quote, change of life with all the hot flashes and everything like that. So I ignored all of those symptoms. I've always been very active. Currently, my biggest complaint is my vision problems. Since about 2 years ago, I started having fuzzy vision. Went to my doctor. I have cataracts now and also have macular degeneration. I had no problem with my eyesight at all, and I'm on hydroxyurea. I've been on it for 10 years. I do believe that has contributed to my problem with my vision. I don't drive at night any longer. A funny thing about my activities, when I can't sleep at night, I live in a over 55 community, which is gated, so I feel safe at any time. So if I have a sleepless night, I get up, I put my clothes on, my jog, and I walk the neighborhood at 2, 3 o'clock in the morning. And there are some of my neighbors who don't sleep also, and they say, well, there goes Sandra, she's running the streets again. But they're aware of my condition, so they kind of keep watch for me. And when I can't sleep, I just go outside, especially in the summer. And when I feel really fatigued, instead of laying down, I take that walk. I push myself further and do it anyway. Ironically, I was diagnosed the year they found the gene, the JAK2 gene, in 2005, and I started researching that myself, and I was amazed. I tried to explain to everyone it was an MPD at that time, and now it was a neoplasm. So when they changed the name to neoplasm, I'm back on the internet saying, okay, it was disorder, now it's a neoplasm. What is that? So, I know I have blood cancer, and it is progressive, and I'm not a quitter, so I just push through everything.
No, it sounds like you do, but when does either that insomnia, the difficulty sleeping, or that fatigue, when does it, I guess, win and impact you in a negative way?
Well, when I've overdone it. I do watch my grandchildren frequently, and when I overdo it with them, I get overly tired, and then I just can't sleep. So I'm not one to sit in a chair and do nothing. And if it's 2 o'clock in the morning, I will take that walk.
Sure. Thank you very much, Sandra.
Thank you.
And then we will come pass the mic all the way down.
My name's Diane, and I have PV. And what's been driving me crazy lately are the night sweats, multiple times over and over all night, which of course then blankets on, blankets off, get up, wipe off the sweat, go back to bed. And so that impacts the fatigue that you have the next day. And so, which then impacts my ability to think when I'm at work and my sharpness at work. So I don't know if the night sweat problem was solved, if the other problems would be solved, or if they're not even related. But I would say that is the one thing that's just not being able to sleep because of that particular problem. Then do I need, you're wiped out the next day, so then you can't, okay, and I'm not going to go exercise, I'm not going to mow the yard, I'm not going to do this, I'm not going to do that. And so it's a cycle. And I think that if that, at least I hope that if that was not a problem, maybe the rest of the day, the next day would be better. So that's probably my biggie.
Sure. And can you tell us a little bit about that impact? I think the first example you gave was that it makes it harder to concentrate at work. Can you just explain that?
And so I have, the common phrase is the fogginess, and the ability to recall things and to get to the point of what I'm needing to do at work. And so what I have, I guess, as a coping mechanism, I take copious notes at work and I have to refer back to them. What did somebody say? What did someone do? What am I supposed to be doing? My to-do lists are getting quite long because I forget to do things. And so, and actually, some of my colleagues know that I take notes, and they'll say, "Oh, did you take your notes?" And I will scan my notes for them. But I just don't feel like I have the edge that I always had, and I don't want people at work don't know what I'm dealing with because I don't have that edge, but I don't want them to know that. So I'm trying to. I guess I'm hiding it, or at least trying to. So.
And is that daily, or is that only on certain days that you're kind of doing that?
More often than not.
More than not.
Yeah.
Yeah. Thank you very much. Hand up here.
Thank you. I wanted to make sure everybody else had a chance to talk since I already told my story, but I think something interesting that's happening for me here today, after having PV for 23 years, I can't believe how many symptoms I've had for years that I had no idea were related. And so, which brings to reality how important it is to educate our medical community, not just the FDA, which of course we appreciate, but I have been saying for 10, 15 years, thinking I had early senility, and my doctors would just slough it off saying, "Oh, no, that's normal." But I've gotten to the point that not only do I, too, take notes when I'm working, but I'm afraid to speak without notes, and I'm a facilitator, often especially because I can't think of a word. But not like we all go through, I can't think of a word. I have no instant recall to the point that it gets in the way, and I need to have something in front of me that I can look at the most common word that or I'm just not being articulate. The other thing that I think is very interesting is how many other symptoms. It sounds like many of us, like not just the fogginess and the early senility. I've never heard about. My vision is very affected as well, early cataracts, those kinds of things. So many things that everyone here has said today. And bone pain, I remember talking to my doctor when my children were little, which means it was 25, 30 years ago, and trying to explain, no, I don't mean arthritis. They're like, well, you probably have little bursitis or arthritis runs in your family. No, I'm not talking about my joints. I'm talking about my bones. My bones ache, and no one ever had any explanation for that. And on. The point is just on and on the list goes. That I think what's most interesting today, and I thank you for the opportunity, is that even those of us who have had this condition for many years are learning something, and I personally recognize the need to share what we've got here today.
Sure. And
So,
Ruth,
thank you.
can you
I thought it was done.
Since you've been learning about things that maybe are a result of your MPN, your hat trick, what have been some of the impacts of those other things that maybe you didn't associate as being a part of your MPF, whether it be the vision problems or the brain fog?
Definitely headaches. I too ran a marathon, but only once in my life, so I don't call myself a marathoner. Certainly can't run anymore. Again, I thought that was arthritis. Maybe it's not. Maybe it's joint pain. Who knows? But I certainly can't run anymore. I think for me, and I alluded to this earlier today, I think all of us, at least what I hear, we're all incredibly strong individuals, and all of us seem to say, well, so I pushed through it, so. But for me, what this whole experience has done is forced me. I rewrote my comments with everyone's help about 5 times because I just kept saying I'm virtually symptom-free, but I'm not at all symptom-free. It has affected my life every day, and yet I'm one of those people, as it sounds like we all are, that I've just pushed it to the back because I refuse to be a victim and I refuse to be a patient, and I've never, until today, never really dealt with how pervasive my symptoms are. And there isn't a day that goes by. Even recently, I'm acknowledging really this week how, for the first time in my life, I don't have more energy than my 30-year-old friends. We're going on bike rides that even not that long ago, I could ride, 10, 20 miles, and now lately, I've been tired doing, a few miles. And me, who's always, somebody else said about being so social and being out there, I'm always everywhere, always active, always walking everywhere, refused to drive because I could walk. And now I'm driving halfway to the farmer's market so that I can still walk and enjoy the farmer's market. And yet, I've not admitted that, not just publicly, but to myself probably until this week. So,
no, that's very helpful.
Yeah.
No,
Thank you.
Thank you very much.
I do have a comment or two from the emails that came in, if it's okay.
Absolutely.
Okay, Sheldon wrote in, he was diagnosed in 2007 with PV. He's age 69. Fatigue, even with Jakafi, is a primary cause of my many symptoms. I can no longer exercise. As a result, my muscle strength has diminished. I am overweight. I don't sleep well. I suffer from chronic depression. I cannot tolerate the anxiety of travel. I need a wheelchair to move about in the airport. I wear a mask for fear of infection. I cannot concentrate sufficiently to meditate or read. I fear any medical procedure because 2 years ago I suffered a TIA as a result of having to discontinue aspirin. And then Julia wrote, excuse me. I try to get most important tasks or desk work thinking done early in the day. I pace myself, sleep later, now get up between 7:30 and 8 a.m. versus full work days of 6 a.m. or 10-hour work days. Like others, I have fuzzy brain, especially when I have trouble remembering basic words, places, and names, and I am a talker, writer, and keep doing so. She's 57. And her diagnosis, I can't recall. It's up here. She didn't report her diagnosis. But.
Great.
Okay.
Thank you. Yes, do you have another comment?
My name is Ned Weinschenker, just shy of 77. I'll be speaking in the next panel. However, there are some additional things I'd like to say because I don't have the time to put them into that. Sure. I'm a very avid hiker, and one of the things that I found is that when I'm low on the hemoglobin, when the anemia gets bad, my calves ache when I walk, particularly uphill. And that has really reduced my ability to do one of the things that I love doing, which is hiking. I did every year up until this past year. There's one hike where I live where we go up to 10,000 feet from 8,000. I tried it right after a transfusion this year, so I thought I'd be in good shape. I made it up to 9,400, but decided to go back at that point. But at least I made it that far, so I'm happy about that.
Yeah, no, thank you very much. So I'd like to talk a little bit about changes in symptoms and in the health effects of your MPN. So both, you know, I've heard a little bit about best days or worst days and, you know, what that looks like, but I want to know if there's anything that you are aware of that makes your symptoms or the severity of your symptoms different from day to day or over the course of time. Is there anything that triggers your symptoms? Is there anything that you've noticed that changes that impact, even if it might be other symptoms? If one flares, it maybe creates increased severity of others. And then for those of you that have had a progression from one form to another, I'd like to hear a little bit about that and where in your disease course that occurred and what that meant for you. So kind of on this topic of changes, yes.
Yes, hi, my name is Monica McHale.
Hi, Monica.
And I'm here on behalf of my mother, Yvonne McHale. And her diagnosis was in 2017, January, after having a bone marrow biopsy and being diagnosed with myelofibrosis, primary myelofibrosis. And my concern on the progression of this illness, I don't like to call it a disease, I don't like to say that, is that when the hemoglobin goes low, I've seen her hemoglobin drop to 4.4 or 4.2, dangerously low levels, very dangerous. Of having access to a center where you can get a blood transfusion on short notice, because they will draw you when your labs are low because they need to know your blood type, your type in your screen. They need to know if you have antibodies to transfusions that you may have had in the past. And this was all pretty new. So my biggest concern is the availability of medications. And some things that have helped after having transfusions, we didn't look to transfusions as a solution, actually, because blood lasts for so long. You have to worry about storage, where you're going to get it. Does it match? How compatible is it? Have you developed more antibodies from subsequent transfusions? And medication, when you research on Google, we all have the internet, seems very limited, not only in terms of knowledge. You have to go to special centers, maybe where there's teaching institutions, and they have a higher level of resources. But the knowledge is pretty, I think it's there. I believe it's there. I have to have hope that it's there. And I think that we've got great pharmaceutical companies that are doing research and development every day. But the cost of the medications that are available, even when people have insurance, are extremely unreal. And these are life-saving medications. And I value the FDA because they oversee the safety of these medications. And I value the companies that manufacture them because that's life to certain patients. But when you see a bill and it comes up with like $5,000, I don't want to blast any particular pharmaceutical company, but let's say there's, you know, when they adjust it and you find an injection that's a stimulant that might help boost your hemoglobin levels, and the adjusted amount comes out to like 2,400, you're staring at that bill like, holy cow. So, and you notice, you won't know until you're in the process, but there's a difference. There's a difference on if you obtain the medication at a facility, at a hospital, versus if you are able to get the medication from that hospital provider on home delivery. And from a specialty pharmacy, it reduces the cost of that medication drastically for out-of-pocket. Instead of being, you know, about $700 or $800 after adjustments, it might be $125. And that's a huge difference. But then there's a secondary issue that arises. And I'm hoping facilities and caretakers and doctors and clinicians can work on this. And that is, if you did get it on home delivery and you decide you want to take it back to the provider has to agree to be willing to take it based on how you stored that medication. And some facilities don't want to assume that liability because it's a risk. It's out of their hands. So I like to see, I've actually seen where you go see specialists and the specialist will say, I'll provide the authorization for you to obtain a medication and you can have it on home delivery. But for convenience, you're not always going to go to that big resource hospital, teaching hospital that's quite a distance away from where your primary residence is. And just to get it on home delivery and being able to take it to a primary care physician and have them, the primary care physician, agree is such a huge relief. But there's so many little nooks and crannies that people don't realize. And we're looking for medications so that there's more options to transfusions. Because transfusions, you're going to be waiting. And that waiting, when your hemoglobin is like 4.2, and they continually want to stick you to make sure that the antibodies are right, and they have to send it out, and they're searching the whole nation to get a little bit of blood. And you're waiting, and you want it to be very compatible. That is a huge emotional roller coaster. And you become very limited in where you want to go, you know. Am I nearby to a hospital? Because you don't get outpatient treatments for blood. So I'm just hoping we develop more pharmaceuticals, and I'm hoping they realistically become more affordable, because a lot of the people that are getting these MPNs, I don't want to say all of them are getting a little bit up in age, but you know, the cost is unreal.
Thank you, Monica.
And yes, that's it.
Yes,
Thank you.
Yes. No, thank you for that context. And what we're hoping to do today is, you know, help set the landscape or the context to bring more treatments to you all. And so I want to continue the discussion and see if in helping us better understand the NPNs, additional experiences that people have with their changes in symptoms, and for those that have actually had that progression from one to another, learn a little bit more about that. That's getting that understanding about the disease is going to help set the stage for additional treatment options. Yes. Back to David.
David Alexander again, PV. I'd like to give you two things. First, patients have taught me, was not obvious to me as a marathon runner, that hydration is very important. If I go out on a warm DC day and I get thirsty, it's over. Don't recover when I get a big bottle of water. Hydration. I have an interesting thing. You'll hear me later complain sorely about pruritus. I was on a course of, a doctor-prescribed course of niacin. And niacin both caused pruritus, but only right after I took it. I never got pruritus at other times. When I stopped taking niacin, because the doctor told me to stop, then my pruritus was much worse and could occur at any times, as I'll elaborate later.
Sure. And David, when you, on the first of the things you're talking about, dehydration, when you're more dehydrated, which of your symptoms are worse because of that?
Oh, fatigue. The day is over.
Yeah, thank you. Other experiences with changes and symptoms, things that you know trigger them? Yep, we'll come right up here.
Hi, I'm Nancy Davidson. I was diagnosed 33 years ago at age 19. I've been, you'll hear me, I'm part of the panel later, but PV, now I'm MF. So I'd like to say I was fortunate enough to be diagnosed that young because I started treating my disorder at the time, my disorder right away. For me, I don't have the constitutional symptoms of bone pain, pruritus on a constant basis. Those only come back when my current treatment is either not working anymore or is slowing down, or when I have to actually stop to get on a clinical trial or stop to start another drug or of that nature. So basically, and each time they come back stronger than the last time. So that's, for me, like I said, it's a bummer that I've had this for so long, but I've been fortunate because I've been treating it for so long. So.
And when you say they come back, which symptoms are you referring to?
Bone pain, night sweat, pruritus, fatigue.
A whole bunch, checklist.
All of them, all the constitutional
Yes.
symptoms, yeah.
Sure.
I constantly live with my spleen, which you will definitely hear later, but the constitutional symptoms, I had it cut out, so I thought I'd let you know.
Yes, but thank you. So does anyone have an experience with progressing from one type of MPN to another? Yes?
Good morning. My name's Keisha. I'm from Wilmington, North Carolina, and I was diagnosed with ET when I was 40. I'm now 53, and last year I was diagnosed with myelofibrosis. So it progressed. When I was 40, I had several TIAs, and it was from that they diagnosed me with the ET. And I went for 13 years with fairly little, I'll say fairly little issues. I did take Jakafi and some other drugs, and then the problems started getting a lot worse. My numbers started getting a lot worse, lots of migraines and those kinds of things. Now I'm on Pegasus, and that seems to be working nicely. Do have the other symptoms that everybody continues to be talking about, lots of night sweats. I'm having some different ones that I've heard just a few people bringing up that I would love to talk about, some skin issues.
Tell us about that.
All over. So if anybody else is dealing with that, I'd love to kind of talk with you privately about it, because somebody mentioned it. Itching, crazy, keeps me away at night, just inflamed. And it's one of the things that doctors say, oh, that's not really a thing, that's not real. And I'm going, oh, but it is for me. It's making me crazy. So if anybody else is dealing with that, please talk to me. Lots of other things that just, is it related? Is it me? Am I losing my mind?
What's an example of another thing?
So like I'll scratch, and then all of a sudden it's like everywhere. It can get infected, it'll spread. It's just like all over my body. It keeps me up at night. And oh, I see some heads shaking going, yeah,
Yes.
yeah, me too, baby. So, yeah, thank you so much.
No, thank you for sharing that. Yes. Oh, here, I'll take that. Okay, any other final comments on things that you noticed that result in changes in your symptoms or in your course? If not, as we're closing here towards the end of our session, I want to make sure that we touch on this last question, which is a really important one. A lot of you have started hinting at this, which is your worries, and your worries about your health in the future. And what specifically are you worried about? Is it a worry related to, we've talked a lot about severe symptom burden. We've talked about progressing. We heard about being transfusion dependent, and a lot of the fears related to that, Monica was sharing. But I know different people have different worries, and we want to hear, what the range of those might be. So if anyone is willing to share what worries them about their future and their health living with their NPN, we'd like to hear that as we work to close out our final question in this session. Yes, Ned.
Ned Weinshanker. Because I've become transfusion dependent, my concern is iron overload over the long term. I don't know how that's going to affect me at this point, and I know there are chelation methods to remove it, but they're apparently not much fun, from what I understand.
Sure.
And given my advanced age, I wonder about my longevity overall with myelofibrosis.
Sure. Thank you, Ned.
If you don't mind, I have one other on that same topic from Aaron, who's been living with the diagnosis of MF since 2017. Currently, I have to be hospitalized every 2 weeks for 2 units of blood since I am now transfusion dependent. I also take medication due to the iron overload in my body. I'm currently taking Jakafi twice a day. I had to decrease my job in physical therapy because of my diagnosis. I feel I am doing more harm to my body with my treatment than the diagnosis.
Sure. Thank you. So we'll do David, and then we'll come back.
For one I know that's common among many of us, our knowledgeable doctor moving or retiring.
Wow, yeah. Makes sense. There you go, Rosemary.
Well, my worries are, because I'm just at the beginning stage,
Sure.
progression and longevity. I always thought I'd live to be 100 because there are, long-aged genes in one or both sides of my family. Cost is an issue. I'm limited income and not a lot of savings. I live alone, so that's an issue. And I think the biggest worry is having a heart attack or stroke and surviving it. And then how am I going to care for myself? I don't have long-term care. I don't have someone around me who can care for me.
Sure. Thank you for sharing that, Rosemary. Other concerns, worries for the future? These are things that hopefully we'll be able to minimize with future therapy. So it's important to hear what they are, so we can think about how future therapies might be able to, address the things that worry you most. Sure, Nancy.
Again, this might be a repeat. Nancy Davidson. I'm going to probably say the same thing in what I'm going to say later, but I know I have the ASXL1 gene, and so one concern for me is the progression to AML. So I'd like to stop it before it gets there.
Yes. Thank you, Nancy.
Yeah, we have a couple more emails coming in from people who previously shared their symptoms.
Yes.
Julia said her biggest fear is progression to MF or leukemia. She's got PV since 2007. And Sheldon, he said his biggest fear is progression to MF. He's had also, scratch that. Julia is 57 post-ETMF, and she fears progression. And Sheldon also fears progression to MF. He's PV since 2007.
Sure. Thank you. Well, I think we'll do our final comment, and then. This is what we're here for. So.
Yeah, the one thing that I would add is, for me, all the personal stuff you heard, which is hard to talk about, but physically, I think that for me, the biggest fear is the unknown that we all experience, the unknown when will the next episode or crisis come along. So we always travel a lot. As I mentioned, I'm married to a Brit. Half of our family's over in England. I've traveled my whole life. Do I plan a trip? Of course I will, and I'll go and I'll enjoy it, but it's on your mind all the time, when is the next crisis? So if we could get through medication, which I am not good about wanting to put, as somebody said, you feel like you've done more damage than good with medications. If we could get to the point that we had a safe pharmacological way to reduce some of these symptoms, it would not only be physiologically beneficial to us all, but the worry, I think, comes a lot from the unexpected, and knowing that, and somebody said it's not when, it's not if, it's when, and for me that's
yeah, make it more predictable. Sure.
Julia wanted to add that she also fears having a stroke, that she has a family history of heart attacks and stroke.
Sure. Great. Well, I want to thank all of you here in the room and all of you that have been actively participating remotely over the webcast. This has been incredibly informative and helpful, and I know it takes a lot to, for a group of people that are used to pushing through, and not letting your symptoms define you and your activities, taking that opportunity to reflect, as Ruth was describing, and share those reflections with us. It's been so helpful. And so what we're going to do is we're going to take a 50-minute break for lunch. We're going to come back at 12:50, and at that time we're going to build on this discussion that we just had and talk about the different ways that you treat and manage your MPN, and look towards the future of what you would be looking for from therapies, now that we have a better understanding of what your actual burden of disease looks like. So thank you all, and we'll see you back at 12:50.